Hi, this is Daniel DiTuro. Are you concerned about developing prediabetes or type 2 diabetes? In this video, I'm going to discuss what is diabetes, the types of diabetes and how they are diagnosed, risk factors for diabetes, symptoms, and how to reduce your risk. What is diabetes? Diabetes, known as diabetes mellitus, affects how your body uses glucose. Your liver converts carbohydrates into glucose, and your pancreas releases insulin so your cells can use the glucose for fuel. Your body tries to maintain about 4 grams total blood glucose 24 hours a day. Insulin is a hormone made by your pancreas. Your pancreas releases insulin into your bloodstream. The insulin allows sugar to enter your cells. Your cells use the sugar's calories for fuel. Insulin reduces the amount of sugar in your bloodstream. As your blood sugar level drops, the release of insulin from your pancreas also drops. Glucose comes from 2 major sources: food and your liver. Your liver stores and makes glucose. Sugar is absorbed into the bloodstream during digestion or released from your liver. Between meals and while sleeping, your liver converts glycogen back into glucose to maintain blood glucose levels within a normal range. For most people, maintaining normal blood glucose is easier when carbohydrates come from fruit, vegetables, legumes, and whole grains. These are foods some people call natural foods or minimally processed foods. Overloading your body with refined carbohydrates floods your system with more sugar than your cells need. When the demand for high levels of insulin is constant, over time, the insulin-producing cells in the pancreas deteriorate and insulin output declines. Total blood glucose levels rise above 4 grams, putting you at risk for prediabetes and type 2 diabetes. There are 2 types of diabetes and a diagnosis of prediabetes. Type 1 is also known as insulin-dependent diabetes. It occurs when the body's immune system attacks and destroys the pancreas's insulin-producing cells. Without insulin, cells cannot absorb glucose circulating in the blood. The exact cause of type 1 diabetes is still unknown. People with type 1 diabetes must test their blood sugar 1 or more times daily and inject insulin to maintain sugar levels. Type 2 is also called adult onset diabetes. It occurs when a person eats more refined carbohydrates than the body needs for fuel. The excess glucose increases blood sugar levels. Type 2 diabetes is usually caused by lifestyle. People with a family history of diabetes may be at a higher risk of developing the disease. It is managed by lifestyle changes and/or prescription medications. Prediabetes is a condition where blood sugar levels are consistently above normal, but not high enough for a diagnosis of type 2 diabetes. Currently, there are 4 methods for diagnosing diabetes: random and fasting blood sugar tests, and oral glucose tolerance test. A1C is a blood test that does not require fasting. It measures the percent of blood sugar attached to hemoglobin and indicates the average blood sugar for the past 2 to 3 months. An A1C below 5.7% is considered normal. Prediabetes is between 5.7 and 6.4%, and diabetes 6.5% or higher. These numbers are averages. When it comes to the A1C test, there is no one-size-fits-all treatment. Discuss the results and options with your doctor. The random blood sugar test does not require fasting. Blood sugar levels of 200 milligrams per deciliter or higher indicates diabetes. The fasting blood glucose test requires fasting overnight. Normal blood sugar level is 100 milligrams per deciliter or less. Prediabetes 100 to 125, and diabetes 126 or higher. The oral glucose tolerance test requires overnight fasting and multiple blood tests. After fasting blood sugar is measured, the patient drinks a sugar solution. Periodic blood sugar level measurements are taken over a period of 2 hours. Normal is a blood sugar of 140 milligrams per deciliter or less. There are several risk factors for prediabetes and type 2 diabetes. They include genetics, extra weight, metabolic syndrome, the liver producing too much glucose, cells cannot use the glucose, pancreas produces the wrong amount of insulin, and a sedentary lifestyle. 3 risk factors with links to lifestyle are extra weight, metabolic syndrome, and sedentary lifestyle. Other risk factors are heart disease, diabetes during pregnancy, stored abdominal fat, a woman with PCOS, being 45 years old or older, and being Hispanic, African or African American, Native American, or Asian American. It's important to recognize symptoms of diabetes because diabetes is a serious disease. In the U.S., it is the 7th leading cause of death. An estimated 30 million adults have type 2 diabetes, and 25% don't know they have it. An estimated 85 million adults have prediabetes, and 90% don't know they have it. Symptoms for type 1 and 2 diabetes are the same and include increased thirst, frequent urination, extreme hunger, unexplained weight loss, presence of ketones in the urine, fatigue, irritability, blurred vision, slow healing sores, and frequent infections. Complications of uncontrolled diabetes are serious and include damaged heart and blood vessels, increased risk of heart disease, high blood pressure and stroke, nerve and kidney damage, eye damage or blindness, cuts and blisters healing slower, sleep apnea, and increased risk of dementia. While there's no cure, you can reduce your risk for prediabetes and type 2 diabetes. In many cases, lifestyle changes can prevent and even reverse type 2 diabetes. A simple lifestyle change is reducing the amount of refined carbohydrates, sugar, and starches in your diet. Unlike fad diet plans, you do not have to totally eliminate refined carbohydrates from your diet. You can substitute whole grain carbs for refined carbs. Reduce or eliminate the number of sugar-sweetened beverages, including energy drinks and flavored waters. Eliminate highly processed protein and energy bars with more sugar than protein. Look for ingredients like evaporated cane juice, which is another name for sugar. Another simple lifestyle change is becoming more active. A sedentary lifestyle can lead to weight gain, and weight gain increases your risk for prediabetes and diabetes. Becoming more active does not mean taking up running or working out for several hours a day. Modern living provides more opportunities to be less rather than more active every day. Some examples are sedentary desk jobs, home food and grocery delivery, house cleaning services, garden and lawn maintenance services, online shopping, or simply surfing the internet or watching TV for hours. Preparing, cooking, and meal cleanup gets you off the couch and moving, and can reduce the number of highly processed refined carbs in your diet. Some studies indicate normal weight, sedentary people increase their risk of having higher blood glucose. How much should you exercise? Some experts recommend 150 minutes a week, about 20 minutes a day. You don't need a gym membership or personal trainer to increase your physical activity. Walking is one of the best forms of exercise. 20 minutes of walking is about 1 to 1.5 miles a day. What is the best diet for preventing or controlling diabetes? Studies of people eating a Mediterranean diet indicates it can prevent and even reverse type 2 diabetes. Advocates of low-carb diets like paleo and ketogenic swear these diets will prevent and reverse diabetes. So who's right? There is no one diet fits all diet. If your diet is not sustainable, you receive little or no benefits over your lifetime. One low-carb diet study reporting miraculous results had about half of the participants drop out. They just could not stick to the diet. Contrary to low-carb diet claims, reduced red meat consumption is linked to reduced risk of developing type 2 diabetes. Simple diet and exercise lifestyle changes may prevent the need for prescription diabetes medications and avoiding their side effects. Please leave a comment if you have any questions about this video. Thank you for watching and healthy eating.